Hi, Mrs. France. My name is NP student Pierre. I'm going to be doing your HEENT exam. HEENT is the head and neck, eye, ear, nose, and throat, and then also your lung and thoracic exam. Okay, so I'm going to be using certain terminologies. I'm going to start by observing you. I'm also going to be touching you. When I say palpate, I'm going to be touching you, and percuss, I'm going to be using a tapping sound. Is that okay?
Yes.
If you have any questions, please do not hesitate to ask.
Okay.
Okay, so now I'm looking at your head. The contour of your head is normocephalic, atraumatic. Hair distribution is even. I'm going to palpate, okay, for any lumps or bumps, any depression, none noted. Now I'm gonna come down to your face. Eyebrows is evenly distributed, it's symmetrical. Your eyelids are not crusted. The hair is evenly distributed. And looking at your eyes, the external appearance, your eyes, there's no scratches, no corneal abrasions, no discoloration. Okay, now I'm gonna be touching your face. Okay. Looking at the conjunctiva, it's nice and pink and moist. I'm gonna look at the top as well. Same thing. Also, I'm gonna feel for your temporal pulses. Nice and brisk. +2. While I'm on your face, I'm also gonna be checking for your sinuses. Any tenderness, any pressure?
No.
Okay. All right, I'm checking for your temporal and maxillary sinuses, just for pressure and tenderness, none noted. While I'm down here on your face, we're gonna be looking at your eyes. Okay. All right. Looking at your eyes, I could see you have good pupil reaction to light. Also, your iris is brown. Okay. So we see that we have pupil is perla. We don't say perla, but pupil is reactive, round, reactive to light. I'm also gonna check for light reaction, direct and indirect. Okay, so I'm gonna bring this over. Okay, the left eye constrict. And look, and then we notice the right eye constrict. So that's direct and indirect. Also, I'm gonna do the conversion test. So I'm gonna need you to stare at my finger, and as it comes closer, and you can see that the eyes comes together. And for accommodation, you're gonna be looking at my finger and then look at the red spot over there. Look at my finger, look at the object, look at my finger, and look at the object. Okay, so we see that with distance, the eye dilate, and with being closer, the eyes constrict. Okay, so now I'm gonna be checking for the extraocular movement. So I'm gonna do a confrontation test, checking your peripheral vision. Let me know when you see my fingers. Look straight in my eyes or my nose. Stare at my nose and then.
I see your finger.
Okay.
Fingers.
Okay.
See your fingers.
All right. Good. Another test we're gonna do is just checking for involuntary eye movement. So follow my finger. Okay. Keep your head straight, just your eyes. Okay. And then that's pretty much it. Now we're gonna do the fundoscopic exam. This requires me to be close to you, okay? We're just gonna check the inner part of the eyes, okay? I'm gonna check, it's at 0. My diameter is not, okay. All right, now it's at 0. So, this is your right side, so I'm gonna be looking with my right. Okay, so I'm staring to see the red reflex. Okay. You gotta get really close. Okay, hold on. Okay. All right, so we notice the red reflex right away, and then inside your eyes, the optic disc is intact, and there's no AV nicking. Now down to your ears. Okay, looking at your external ears, there's no foreign body, no objects, no drainage noted on both sides of the ears. I'm checking for tenderness. Okay. The pinna and the auricle, there's no, do you feel any tenderness?
No.
Mastoid process, no tenderness.
No.
All right, now we're gonna do the whisper test. Close one ear for me. I'm gonna whisper something and let me know if you hear it.
Red.
Okay, now let's do the other ear.
Yellow.
Okay, so hearing is fine. And now we're gonna look inside the inner ear. Okay, looking at the inner ear. Okay, well, that would be great if you to imagine. I'm gonna imagine that it works because it's not working. Oh,
It's on.
yes, now it is. Okay, so we're gonna pull the pinna up and back because you are an adult. I see there's no discharge, no hematomas. The inner ear canal is clear. Tympanic membrane is pearly gray and with good cone light. And then to save time, we will do the same for the other ear. Okay. Now we're gonna check for ear and bone conduction by doing the Weber test and then the Rhine test. Okay. So you're gonna let me know. I'm gonna strike this and place it on top of your head. You let me know if you hear the vibration on both ears.
Yes.
Okay. Very good. So we have good lateralization. There's no hearing loss. Now I'm gonna do the Rhine test. I'm gonna strike this and place it. You let me know when you stop feeling it. Okay. Let me know when it stops.
No. I hear it still.
You still hear it, right? Because we know AC is greater than BC, so that's air conduction is greater than bone conduction. Okay, that's it for that. And I'm gonna be feeling your neck. Your neck is midlined, symmetrical, no deviation. Trachea is intact. There's no injury noted. I'm gonna feel for your lymph nodes now. You have the occipital nodes. You have the pre-auricular, post-auricular. You have tonsillar node. Nothing palpable. Your maxillary and your submental, submandibular, submental, none noted. And you have your supraclavicular. There's no palpable node noted. Turn around for me. Testing for the superficial chains, not noted. Posterior chains, not noted. And then the deep one would be underneath the mastoid muscle. That's pretty much it for that. Okay. Now we're gonna do the respiratory. So looking at you, your breathing is fine. You're not in distress. Your thoracic area is symmetrical. There's no obvious trauma noted. So now I'm going to palpate, and when I press on your chest, you're gonna say 99 for me.
99. 99. 99.
Okay. So you hear good vibration. So now I'm also gonna percuss, okay? Okay, yeah, at that point it's becoming dark. Okay, so we have good resonance, and I'm gonna listen to your lungs. Okay, when I tap, just breathe in and out for me. Okay, lung sounds are clear bilaterally. Okay, I'm gonna do the same thing for the back. Turn. So turn for me. All the way. Okay, looking at the back, symmetrical, nice rise and fall of the back. We're going to also do the same thing. Okay, I'm palpating. Any tenderness? No tenderness or lumps, nothing noted. Say 99 for me.
99,
Mm-hmm.
99, 99.
Okay, tactile femoral is noted bilaterally. And I'm going to percuss, okay? Okay, I hear good resonance sound. So now I'm gonna do the chest expansion. I'm gonna squeeze here and breathe in for me. Okay, my hands move at the same time. For the diaphragmatic excursion, turn around for me. Put your legs straight. Okay, very good. So I'm gonna do the same thing. I'm gonna be percussing, but I'm gonna need you to breathe and then let it, and then hold it for me, okay? I'm gonna let you know. Breathe in and hold it. Okay, let it out. All right, one more time, and now I'm gonna need you to breathe, and then as you exhale, just hold it after exhalation, okay? So same thing, go ahead. Breathe out, and then hold it. Okay, so this is measuring about, we say 3 centimeters, which is fine. Okay, now I'm going to listen. Just same thing, breathe in and out for me. In and out, in and out, in and out. Okay, you have good lung sounds. And that concludes our test. Thank you so much.
Thank you.